Hi, Dr. Ramsey Choucair, plastic surgeon in Dallas, Texas, continuing our series on educational videos in plastic surgery. Today we're going to talk a little bit about male liposuction, primarily around the midsection of the flank, where many men, despite working out and being active and healthy and in good shape, genetically have fatty tissue that collects around this section, primarily in the flank and in the abdomen. The first category I'll mention is something that we can't do much for. It's the patient who comes in with a little bit of a protuberant belly, a man who comes in, he's in good shape, but genetically he has internal fat around his intestines that really push him out. And when you have them tense their muscles, they think they've got all this fat here, but when you feel their muscle on top of their skin, there's no fat. So those are the patients, unfortunately, we don't have a good answer for. Many of those patients have a little fatty tissue below the belly button, and we can make that better, but many of them come in because they have a protuberant abdominal area, and many times we just don't have an answer. And some of that's really genetic, and of course also weight loss can make a difference, but many of these men are not overweight. The area we make the most difference is in the flanks, because in the flanks, this area is a genetically prone area in men to collect fatty cells, that it's all genetics. I mean, I tell most men and women also that if you could lose these fatty bulges on your own by diet and exercise, you wouldn't be here. So it's usually diet and exercise resistant fat pockets that may be developing as people get older or could have been there since they were young. So in the flank, the success of liposuction is very good because this is your muscle, that's your skin, and we're taking those fat cells out. We have to leave some. And the skin usually shrinks well in the flank because the skin is thicker and has not lost too much elasticity. Many times, no matter what, you'll have a little bit of a bulge here and here due to the muscle, but certainly it makes a difference. Now, you want to mention the non-surgical fat removal at the same time because many men come in and say, well, I've heard you can do this without surgery, and the recovery is zero. I can go work out immediately after something like cryolipolysis or Coolsculpting, you may have heard. That's a system that we've had in our office for 7 years that works, but we're very cautious about who we do it in because Coolsculpting is a device that has different attachments that you attach to the tissues where the fat is, and it pulls the skin and the fat into the machine, and you sit there for 35 to 45 minutes, and it freezes the fat. And because the fat cells die at a better temperature than the skin, in other words, the skin's not frozen and frostbite because there's no skin that's going to be injured at that temperature, but the fat can be injured at that higher temperature. And so after you take the machine off, the skin is raised and it smooths out within a few minutes. It's kind of a frozen area of fat and skin. And then you go work out and you do your own thing. And over 2 to 3 months, that fat dissolves. Now, the question is how much of that fat dissolves. So if you do liposuction, there's the skin, there's the muscle. You're taking 80 or 90% of all the fat out with liposuction. And those cells that you remove are gone forever. So you'll never be as large in those areas. However, Coolsculpting only takes out 20% of just the skin and fat that's pulled in. The expectation, again, is the key here because patients come in expecting maybe the result from liposuction when they're clearly not going to have that kind of dramatic result, but it works. So liposuction works for almost everybody because you know you're making a big difference, but it's surgery and there's a little bit of a recovery. Coolsculpting, however, clearly makes a difference, but not near as much difference. So again, all those things matter, especially in men who are on the go and want the result and are somewhat impatient to get the result as quick as possible. So all those things we try to discuss and make sure men know about all the options in the midsection.